Some Central Texans are getting COVID-19 tests in the mail by the dozens. They tell KXAN investigators they never ordered or even wanted the at-home tests and have noticed charges on their Medicare bills. Arzo Dos talked to several families who reached out for help and learned that some of the tests that they're receiving are already expired.
Sometimes you get 4 tests, sometimes you get 8 tests.
Suzann Madeley goes through her haul.
And this has 4 of them in it. It's the same. This is the same.
COVID-19 tests she never ordered or wanted, but that have been showing up by mail to her Austin home. Some even expired.
Here I am sitting with all of these that could have been used by someone, and it makes me furious. It makes me furious. It's so needless, and it's very frustrating.
And we got probably as many as 50 of them, if not more.
In Dripping Springs, Richard McGinn has his own stash.
It was from places in California and Wisconsin and Florida. Different laboratories were sending them to us.
He says what's even more troubling is that Medicare is paying. McGinn showed us a statement he received in March where Medicare had been billed $200 for a COVID-19 test. The amount paid by Medicare was $94. McGinn didn't owe anything.
This was in one of the packages. Thanked me for my recent order over-the-counter COVID tests at no out-of-pocket cost to me, and I never ordered any of it at all.
The Centers for Medicare and Medicaid Services says from April last year through the end of the pandemic in May this year, Medicare covered COVID-19 over-the-counter tests for people who requested them. A spokesperson says CMS received calls from some Medicare beneficiaries who reported receiving tests they did not request.
It's a waste of supplies. It's a horrible waste of money.
The spokesperson says the number of complaints represents a small portion of people with Medicare, and the agency is investigating instances of potential abuse. An indictment obtained by KXAN investigators shows in April charges were filed against 2 people in Florida for allegedly unlawfully purchasing Medicare beneficiary identification numbers and shipping over-the-counter tests to them, in some instances deceased patients nationwide who did not request the tests. The Department of Justice calls it a first-of-their-kind charges and says it cost over $8.4 million in fraudulent claims to Medicare.
So here they all are. I haven't used any of them.
Madeley started calling the labs and warehouses sending her the tests, but says she was never able to connect with anyone. She, too, was seeing Medicare billed.
None of this has cost me a penny, but it's been costing the taxpayers a lot of money.
She says she's been reporting every shipment to Medicare.
I would be surprised if anything ever happens, but I sure hope it does.
Arzo Dos, KXAN investigates.
KXAN investigators have reached out to the labs and the warehouses sending out those unwanted COVID-19 tests, but we have not heard back. We also reached the attorneys for the people who were indicted in Florida for conspiring to defraud the United States. The attorney for one of the people charged says someone was using his client's provider number for the alleged fraud. A lawyer for the other person tells KXAN investigators they don't comment on ongoing cases. CMS says everyone should guard their Medicare number like their Social Security number and their credit cards and only share it with trusted healthcare providers. As for getting expired tests, CMS says the expiration date on some tests have been extended by the FDA, but you should report it as it can be considered fraud. The CMS spokesperson adds if you're getting tests that you didn't order, call 1-800-MEDICARE and report it. This story started with a tip. If you have something that we should investigate, let us know. You can email us at reportit@kxan.com.